안녕하세요. 반갑습니다. Welcome back to another session of Dentium live surgery. My name is Jung Chul Park, and I'll be your moderator today. Tonight, we are going to try a new thing. We usually have a moderator here, and we have the operator in the surgical room, and then we lively broadcasted the surgery with the comments of the moderator. But tonight, I will be self-moderating myself, and then I also perform the implant surgery in the operating room after this case presentation. So I hope that you'll be excited as much as I am tonight, and I wish that we have many more cameras in the operating room, so I'm positive that you will have a better chance to look and observe what's going on in the operating room. So we will start the case presentation. The patient is a 77 years old male, and he came to the clinic with a missing teeth in 16, 17, and tooth number 24. Tonight we will place implants, 2 implants in tooth number 16 and 17. And as you can see, there's quite a lot of bone loss at tooth number 46 and 47 with the furcation involvement. So at this point, it looks like these teeth are a little bit questionable or maybe hopeless, but we are not going to extract tonight, but we will wait and decide after we finish the implant surgery and the crown delivery, then we will evaluate later. We want to save the native tooth as much as possible. So our plan is we're going to place 1 implant in tooth number 16 with the simple implant procedures, and we are going to acquire bone chips, autogenous bone chips with a special drilling technique. We will go over that procedure in the operating room while I'm doing the live surgery. And we are going to place tooth number 17 with a crestal approach sinus lift and the simple, maybe a minor GBR, guided bone regeneration, is expected. And then, as you can see, we have a quite nice keratinized tissue, so tonight we are not going to perform any soft tissue management, but during the operation, maybe there will be some requirements to cover and augment the keratinized tissue, and then we will use some biomaterials coming from Dentium. So we will see and watch. This is the clinical photo. As you can see, the tooth missing in 16 and 17 and tooth number 24. And this is the panoramic view before the operation, and the teeth were, especially 16 and 17, were extracted due to the periodontitis 6 months ago. But as you can see, the bone healing is not really perfect, so we can expect that maybe a little bit of the healing is delayed due to his ages, or maybe due to his medication. The reason he's taking the medication is hypertension and diabetes. But luckily, both of the diseases are very well controlled. And very interesting thing is that he has multiple Dentium implants, and especially on the upper left side, these 2 implants are placed 13 years ago, and it's Dentium implants. And as you can see, the marginal bone level is very nicely maintained, and especially tooth number 27, the bone is above the implant fixture. It means that there's a very nice bone reaction due to this implant system. This is a cone-beam city cross-sectional view, and the tooth location is tooth number 16. And we have measured, and the bone level is around 7.6 millimeters, so there will be no problem to place 8 millimeter. Maybe there will be a little bit of the penetration of the sinus lift, but maybe we're not going to perform any sinus lift bone graft. We will just place the implants. But during the preparation, we're going to collect a lot of autogenous bone because this is a very nice area to collect the autogenous bone. So we will use the harvest drill or the conventional Dentium drill. We have no idea yet, but we will see and decide in the operating room. So anyway, I will show you the special technique to collect the autogenous bone with a great healing source because they have a lot of stem cells and very good growth factors too. This is another cross-sectional view from the cone-beam city to location 17. And unfortunately, this area has a little bit of sinus pneumatization And also palatal area, there's a bone resorption. So it only measured up to 5.2 millimeter. So tonight we're going to place the 8 millimeter implants, and we short 3 millimeters. So it's not very serious situation, but still we have to perform the sinus lift. But due to his ages and due to the sinus membrane thickening, we're going to perform the crestal approach. And we are going to use the osteon collagen 3 and also maybe use the autogenous bone collected from during the preparation of the tooth number 16. So this is the general idea that we are going to perform tonight, the live surgery. And please take a closer look of the instruments. During the operation, I will have a chance to actually show you how the drills and instruments are used. But before we jump to the live surgery, I want you to have some general idea. This is the Dentium conventional surgical drills. On the left side, this is a cylindrical, very parallel-shaped implant, which has been used more than 10 years. This is the classic Dentium drills. But as you can see, we have a new Dentium drills with a stopper. So we did not have a stopper, and it was sometimes by accident or intentionally, we go deeper because it didn't have the stoppers. But now we have the stopper. It's much more safer, and it is very, very much efficient because you can apply direct up and down motion. It cuts the bone better and faster. But the problem is this stopper requires a lot of drills. So conventional drills were quite simple, but this stopper drill has many more drills. So in the operating room, I will show you both of the drill kits, and you will see by yourself. And secondly, I told you that I'm going to perform a sinus lift, not from the lateral, but from the crestally. So what kind of instrument what I'm going to use is the DUSK kit. On the left side, this is the conventional gold-coated, typical Dentium sinus kit. It has multiple drills with the diamond-shaped, dome-shaped drills, and the reamers, and the 4 instruments with a little bit of the curved and angled instruments. It has been used more than 10 years too. But now we have much more simplified and much more straightforward kits. It's called a sinus kit, and this is a brand new. It's stored in a metal bracket, and it's more darker, and it looks very cool. So tonight I'm going to show you how to use it, especially the crestal approach. It has a very interesting gimmick. So if you have no idea what I'm talking about, tonight you will be watching it, and this is a very easy way to approach the crestally. And finally, this is the classic osteotome technique. Many surgeons still prefer to use this osteotome technique. This is a very classic procedure, and people want to use the safer one, so they use the sinus kit or DUSK kit, but still, this osteotome is a very straightforward and very time-saving and very also controllable, because you can actually feel the resistance of the bone and actually can get the idea where you are located. So I will show you, maybe I will have a chance to show you how to use this osteotome technique. So tonight I will be using the bone, and also I'll use the osteotome, so it will be bone-added osteotome technique. Sometimes we call it bone-added osteotome sinus flow elevation technique. So anyway, this is the brief case presentation regarding tonight's surgery. So I will be preparing for the operating room. So we will come back and we will see you in the operating room after this short video. Now we are in the operating room. The patient has received the local injection, local anesthesia, and the surface has been decontaminated. And all of our staff are ready for the surgery here. Today we are going to place the tooth number 16 and 17, and my position will be 9 o'clock or slightly 8 o'clock, or sometimes 7 o'clock. So if you are right-handed, you can approach like this. Please leave your comment here. What is your best approach for the 16 and 17? Do you prefer the top of the head, or you may go to the 3 o'clock, or you may go to the 9 o'clock, but it's up to you. So I want to hear your opinions. And I have received the data from Dentium, and there are more than 10 countries watching this live video. So I'm pretty sure that you can represent your country. So leave your name, your country, and what you think about the surgery. Please keep chat room flow. So we are going to start the surgery, and the best way to start is to use it's a small periodontal probe to evaluate the oral cavity. As you can see, we have two spaces, and not like the photograph, clinical photograph, we have lost a little bit of the buccal resorption on the tooth number 17, so we may have to expect a little bit of GBL and the soft tissue augmentation. 자, 입 한번 다물어 보시고요, 어금니로. 네. And as you can see, the vertical dimension is not really great enough because this tooth number 14 has been supra-erupted due to the missing teeth. So later on, we may have to extract or do the crown preparation to create the vertical dimension. So we will see that later. 자, 아예 보시고요. So we will begin with the Mid Crystal Incision. So this is the blade 15. We're going to go for slightly in the middle of the Mid Crystal approach here. The best way is to start from the distal and all the way to the mesial, always. It is the principle to place the incision. 하다가 불편하거나 아프시면 손 드세요. Since we have a little bit of the thick soft tissue, the 15 blade is quite going very deep. Now we are changing to the blade 12. Changing to blade 12, and yes, I feel the bone. So which means that we have a lot of thick soft tissue to manage today. Maybe we have to thin it out later today. And always you have to go for the pizza cut. You have to touch the bone and then properly place the incision. At the end of the mid-crystal incision, I go slightly 120 degrees. It's not vertical incision, but it's kind of horizontal and vertical incision. We call it cut-back incision. So this is the cut-back incision. It's going to help us to properly see what's going on under the flap. So this is the two instruments that I really like. This one is the Auburn knife, and the other one is the Kirkland knife. And you can use both of them, but my preference is always the Auburn knife. It is the angled. You can approach the buccally, and you can approach the palatally. It's a very easy tool to use. So I will show you how to use this Auburn knife. This Auburn knife is angled, like I said before. You follow the flap and then cut the periosteum. If the soft tissue had an inflammation or infection, it is very difficult to properly cut. So this Auburn knife helps you to properly cut the periosteum. Do you see that the Auburn knife is going deeper and deeper, moving back and forth, right? So you do not really refract the whole flap, but you create a space to put your periosteal elevator. So you reverse the Auburn knife and you approach the palatal aspect. You do the same thing. You go back and forth, and properly detach the periosteum. And now this is the periosteal elevator. This periosteal elevator will help me to retract the flap. 불편하지 않으시죠? 네. Now I'm carefully reflecting the flap. Do you see that how carefully I move around the soft tissue? Once the flap is torn, it is very difficult to manage to properly close the surgical wound. So that's why I'm moving very slowly. And I don't want to hurt any soft tissue. And this is the back action chisel. You can use this tool to pull the flap to the buccally, and you can retract the flap like this. And since we have some previous inflammation here, so it's a little bit difficult to properly detach the periosteum. But we are almost getting there, so please bear with me. And at the distally, there is some additional soft tissue attachment, so I'm using the blade again to cut the remaining soft tissue. Okay, there we go. 석션 잠깐만 빼주시고요. 네. Now we see the bone, and as you can see, the bony healing is not flat and it's a little bit difficult to see, right? So we are placing additional incision. This is the papilla-based incision. And later on you will see that it is very easy to suture and it heals really well. So this is the papilla-based releasing incision. And by placing a very small incision at the base of the flap, you can retract additional flap and you will have a better visualization of the bone here, like this. So we have the visual here. And I will use the additional periosteal elevator here. And then we have a little bit of the sticky granulation tissues. Okay, there we go. So from this aspect, I don't see much bone here. So we have to find the remaining bone, which will be very difficult. I have to cut the soft tissue here. Okay, I have cut it. Now there you go. And then by pushing actions, I think I will use the mold curette. And then by push motion, I can go over the bone, as you can see here. I can go over the bone and detach and remove the soft tissues here. And especially at the tooth area 16 and 17, there's a huge granulation tissues, right? So I think I'm going to use some tools like this one, or hemostat usually sometimes works. Okay, there we go. 불편하신 게 없으세요? And additional soft tissues there. So we were planning to place 4.5 millimeter implants, and I think that it was a quite nice idea because we do not have a really wide bone here. So there's a lot of resorption, buccolingually too. So please always do not believe your CBCT images, because sometimes they have deceptions, so you may be fooled. So we will start the osteotomy, the drilling, but later on we will have to see that maybe we should do the submerged healing. We were thinking that maybe we can place the healing abutment today, but I don't think. Maybe we will have to submerge DBL today, but we will see. We will see that we will do our best to prevent it. Okay, now we're going to clean a little bit up. 자, 물이 좀 나옵니다. 자, 물이 좀 많이 나와요. And as you can see, I'm using this side view mirror. This is a very easy tool to use because I can see the general idea of the dental arches and the bone area. So, okay, we are missing a lot of bone here today. So use your side views properly and you can get the general ideas. 자, 잠시만 다물고 계시고요. So now I'm going to introduce the tools that I'm going to use today. These are the osteotomy tools from Dentium. This is the conventional old Dentium drills without any stoppers. So there are actually 12, yes, 6 long drills and 6 short drills. And these drills does not have a stopper, so sometimes you can make some accidents by going too deep to the sinus cavity or to the inferior alveolar nerve. But this is a classic. A lot of experienced surgeons prefer this one. But recently, Dentium has introduced the new Dentium drills. This is the drill with the stopper. So instead of this drill, these drills had 12 drills, but now, as you can see, it has 18 drills. They have 8 millimeter, 10 millimeter, and 12 millimeter length, and they start from the Lindemann drill and to their final size drill. So a little bit of tricky drills, but if you just follow the drill, because it has the stopper, you can just follow the stopper, and it is quite proof of the accidents. If you are still an experienced surgeon, still you can use the stopper. If you choose the 10 millimeter, but you can use the 8 millimeter drill. You don't have to go all the way. You just follow 8 millimeter, but still you have 2 millimeter space, so it will eventually prevent the accident. So today I'm going to use both of them and to show you how these drills will work. And also please watch this ICT wireless motor here. This is the implant motor so that you can do the implant drilling, osteotomy, but this is the wireless. You can see the wire here, but it's actually connected to the handpiece, and there is no power cable or no cable to the pedal. So you can use this tool, and you can do up to 250 surgeries. So this battery is very strong, and you can do a lot of surgeries. And I will show you the pedal. This is the pedal. This is the pedal without any cable. So this is the wireless pedal. So on the left side, the wider pedal is the push on and off button. And small one, they can change the program. So using this wireless pedal, you can do the surgery. And there you can see there's no wires or cables. So it's quite safe and it's quite clean. So it's very easy to do, and it helps you do the better surgeries. So we will move on to our next surgery here. We are going to the tooth number 16 first. Our first program is the 1035 Newton. 자, 이제 임플란트 드릴링 시작하겠습니다. 자, 네. 반대쪽으로, 반대쪽. 네, 좋습니다. 자, 조금만 크게 해주셔야 될 것 같아요. 옳지, 고맙습니다. So I've just stopped it to create a small indentation. The reason is I want to see how my drilling has been done. So it's properly aligned with the central groove, and it has around 4 to 5 millimeter distance from the adjacent implant, tooth number 15. So it's easy and it's quite nicely located. So we are going on to the proper drilling. Okay. So I'm going in a little bit and a little bit more. Very good. I don't go to the whole depth. I'm going to stop here. And I'm going to change to the Lindemann drill with the stopper because it's easy to do and it's quite safe drill. Dr. Rostam from Uzbekistan, thank you for joining us, and we are very happy to have you here. If you have any questions, please post your questions. Now, as you can see, I'm 8 millimeter all the way to the depth, but because I have the stopper here, it blocks me. It only stops at the 8 millimeter. It doesn't go further. So I'm very safe from the sinus. I'm going to show you how I'm safe from the sinus when I do a little bit more osteotomy. Now I'm changing to the second Lindemann drill. And it is the 8 millimeter. You just follow the bone. Very good. There you go. 불편한 데 없으시죠, 지금? 잘하고 계십니다. So I'm checking for these mushroom tools or small periodontal probe maybe. Yes. This small periodontal probe will go inside the osteotomy site and check for the penetration. I don't have the penetration. Very good. So this 8 millimeter is okay. So I'm moving on to 3.4 meter diameter and also 8 millimeter implant. 자, 물이 좀 나옵니다. Very good. Now this defect does not have enough bone to the palatal aspect, but luckily we are having a lot of nice bone to the buccal aspect, so it won't be any problem. Now we are going over to the 3.8 final drill, which will be 4.0 millimeter diameter. And also, greeting from Indonesia. Thank you. Thank you for joining us. Thank you for representing your country. 자, 물이 좀 나옵니다. So we are one step away from the final drill. We are placing 4.5 today here, 8 millimeter. And as you can see, we are nearly 10 millimeter with the stopper drill. And there's no penetration here. So maybe I can place the 4.5, 8 millimeter. 4.5에 8 오늘 심겠습니다. Maybe I will do some extra final drill to the buccally so that it will be easy for me to properly angulate it. 잘하셨습니다. So I'm checking the final package here with a number 4.5, 4.5 and 8 millimeters. So I don't want any accidents about misunderstanding or miscommunication. So this is the right one that I'm looking for, 4.5, 8 millimeter implants. 아유, 잘하고 계십니다. 첫 번째 임플란트 곧 들어갑니다. So I see some soft tissues here, so I want to clean up before I place the implants. Now let me use some tools here. Very good. The bones does not really like the soft tissues because if they get between the implant surface and the bone, they cannot really become the bone. Later, many years later, maybe they will become bone, but in the early stage of the osseointegration, it requires the fresh bone cells, not the soft tissue. So I'm removing all of the soft tissues here. I'm cutting the soft tissue here. I'm looking for some tools to remove the soft tissue again. Yes, this is the granulation tissues again. Yes, a lot of soft tissue defect. Yes, we are almost ready to place the implants. So before we do the implant placement, always check the implant motor because you may have some accident. So change to program 2. It will be 50 RPM with a 70 Newton centimeter rotation, and there will be no irrigation. So there will be no irrigation. This is what I do. Before I place the implants, I always check the engine first, if it is the right program that I'm going to use. And this is how you connect the implants. Open up the vial. Open up the vial. 긴 거군요. 네. Open up the vial. I'm changing to shorter fixture mount here. Open up the vial, approach from the top, and rotate a little bit. And then tilt it upside down and remove the plastic vial. And then hit the pedal to see that implant is rotating properly. And now we are ready for the placement. 자, 임플란트 들어갑니다. So, very good. The implant has been nicely located. And the torque that I felt from my hand was quite nice enough to place the healing abutments. So today we are going to place the healing abutments. So now we are moving on to the second implant. This is what I do. I use the oven knife or the Kirkland knife or oven knife. 자, 한번 살짝 다물어 보실까요? So I always checked the occlusion. So 16 has been the right place, and how about the 17? So considering the location, the 17 will be somewhere here. So I check always before I start the osteotomy, and when I'm very confirmed with the location, then I start the osteotomy. 네, 아예 보시고요. Okay, this will be my placement site. So this is the right position. And from now on, I'm not going to use the full speed drilling, but I will use a very slow rotating RPM because I want to collect the autogenous bone. So I'm changing to the program 1, which will be 1035 Newton. And then using this properly, I'm going to use the short Lindemann drill to just make a small indentation to find the location. 조금만 오른쪽 해주실 수 있을까요? 네, 맞습니다. 자, 물이 좀 나옵니다. This is it. So I don't go deeper than that. I just create a small hole. And we will see how we're going to place the implant here. So again, check the occlusion again. 자, 천천히 한번 물어보실까요? 좋습니다. 아예 보시고. So we are okay with the location. And we will do the additional indentation and then start the slow rotating implant osteotomy autogenous bone gaining technique. Okay, this is the position. And then the second Lindemann drill with a stopper, I will go only 5 millimeter in length. I don't go deep, just I will go 5 millimeter in depth. So I'm changing the location here. 좋습니다. 이렇게 나옵니다. 좋습니다. So from now on, I will collect the autogenous bone using this drill, slow rotating drilling technique. So as you can see, I'm taking this vial with a saline in it. I'm going to put my drills with the autogenous bone. Later you will see. Now I'm changing to the program 2 for the very slow rotation. This is not about the osteotomy, but this is about the collecting the autogenous bone. So do you see that the drill is rotating, right? And then I come out. I come out with a little bit of the autogenous bone. I take out my drill and I put it into saline. Later on, I will collect this autogenous bone. Again, the second drill. 자, 이제 또 조금 아파요. Okay. Again, I'm collecting a little bit of more autogenous bone captured inside the fluid of the drills. I take out my drill and I put it into saline again. And then already we are going on to the 4.5 millimeter final drill. Final drill again, very slow. And then slowly I rotate it and take it out. Additional autogenous bone, right? This is the autogenous bone. So I'm taking out the drills and put it into the vials again. Okay, 이명원 선생님 감사합니다 for your comments, and also Dr. Maxim, thank you very much for your kind comment. So the personnel from Dentium will connect you regarding these webinars. Okay, I'm checking the depth of the implant again. Let me see how far we can go. Okay, there is no penetration yet. Okay, which means that I can go a little bit deeper. Great news. So I'm taking out the final drill again. And when you take out your drills, carefully remove the autogenous bone from the drills. Later on, you will love this autogenous bone because you can collect quite a lot of autogenous bone. Again, I'm connecting the drills again, and then I am drilling to collect the autogenous bone. So this is not a full drill. It's a very, very slow drill, 50 RPM. And then I collect the autogenous bone here. Okay, very good. Dentium actually have the same drill for the same purpose, the called harvest drill, but I believe that many of you will not have the same drill. So today I'm going to use the conventional drill for this technique. Now I'm checking the location. Very great. Excellent. Aligned with the central groove. I'm checking the location, and luckily there is no penetration. So we are going to go a little bit deeper than this one. And in order to do this, I'm going to show you this very unique tool. This is the new Dentium dusk drill for the crestal approach. So this is the 6 millimeter, 8 millimeter. But when you rotate it, you can manually change the stopper. So it's a kind of a transformation stopper or something like that. So this is the 6 millimeter, but you don't want the 6 millimeter. You can change to 8 millimeter, and now this is the 8 millimeter stopper. So it's a convertible stopper. So using this one, we will start with a 6 millimeter, and we are going for the crestal approach. 자, 드릴 조금만 더 할게요. Okay, so 6 millimeter was not enough, so I'm changing to 7 millimeter, slightly changing to 7 millimeter, and we will see that if we have the penetration, but still there is bone. Still there is bone. And still there is bone. So I'm finally going for the 8 millimeter. And still there is no penetration. Wow, this is actually higher than we expected from the cone beam city. I will check if there is a penetration or not. No penetration at all. So it's a really, really wider and thick residual bone. We will go a little bit more then. How about 9 millimeter here? So you check the path and you go 9 millimeter. And still there is no penetration. Maybe we can place the whole 8 millimeter. It's a very great news for the patient. And this is the conventional dusk kit I'm showing you now. It has the same stopper, so it has the 2 millimeter exposed, right? So if we remove this old stopper and change to the different one, like this one, and 2, 4, 6, 8, it has the same 8 millimeter stopper. So you can use the both of them, but I like this one because it has the diamond burr at the tip of the drill, so you can atraumatically remove the bone. We're going a little bit once again. 다시 한번 들어가겠습니다. Okay, did you see that? There was a little bit of push inside the cavity, which means that I have penetrated through the sinus floor. So using this probe, I will check if there's a penetration. And yes, I feel a little bit of this soft tissue at the 10 millimeter, measuring from the buccal aspect. So I get the information. So it's the 10 millimeter, but I will place the 8 millimeter anyway. But I'm using this tool to the final dusk kit. The reason that I love this one is it has the diamond at the cutting edges on the lateral, not on the tip. So it's very safe. It does not perforate the membrane, but it cuts the hole, makes the cylinder. So you get the idea. You are creating the channel to place the implants without hurting any membrane. So I get the information at the 10 millimeter, there was a penetration, and I'm using this tool for the 10 millimeter penetration. And I'm clearing out the residual cortical bone. So do you see the movement that I do? Yes. I'm trimming around the bone. Very good. Now finally, we are ready for the bone augmentations. So if you can see here, this is the autogenous bone with the drills. Yes. This is the autogenous bone captured inside the drills. You remove the bones from the drills, one, and you remove another drills, number two, and you remove another autogenous bone from the final drill. So, if you put your gauze here and you remove the lines, this is the around 1.8 milliliter of the osteotomy, autogenous bone. So it's quite a lot of the autogenous bone. And if you mix it with the osteon 3 collagen, which is a synthetic bone, you can make much more bone formating osteogenic bone graft. 자, 오스테온 3 콜라겐 하나 주시고요. So my assistant will give me osteon 3 collagen, and I'm going to mix it with the autogenous bone here. So yeah, this is the osteon 3 collagen, hydroxyapatite and beta-TCP. 살짝 다무시고 계셔도 될 것 같아요. 네, 그 정도 좋습니다. So, as you can see, I'm taking out the osteon 3 collagen, which is very hard. At this time, it is very hard. But if you put it into saline, and if you mix it, then it becomes immediately soaked like this, and now you can mold it. It was very hard, but now you can squeeze it. Do you see? It has a shape, it has a formation, and then if you mix it with the autogenous bone, it becomes a very fantastic osteogenic bone graft materials. So this is how you make a nice osteon 3 collagen mixture with the autogenous bone. So we are ready for the bone graft. And finally, I'm going to show you the osteotome technique. So this is the osteotome. 자, 그 컨벤셔널 오스티오톰 하나 보여주시고요. 네. So, this is the osteotome with a flat-ended, and we have the convex osteotome. But bone augmented osteotome technique requires this flat-ended osteotome. So we are going to use this tool today. And because we have a 10 millimeter length to place the implants, so we are not going too deep, maybe up to 4 millimeter, but it will be quite enough for us. So let me start with the middle section here. And we will have the small mallet here. So using these tools, 자, 머리를 살짝만 제가 딱딱딱 두드릴 거예요. Very good. It's already 10 millimeter. And then, using this hydroxyapatite beta-TCP, osteon 3 collagen mixture with the autogenous bone, I'm going to graft it into the socket and then do the molleting again to introduce the bone to the defect again. Now I'm putting a little bit more bone here. 자, 이제 뼈 여기다 넣고 임플란트 이제 심으시면 이제 끝입니다. Now I am using the molleting again. Carefully. We do not want the penetration. Do a little bit squeezing movement. Okay. Very good. Very good. 자, 코로 한번 우리 코 풀 때처럼 한번 한번 해보실까요? 오케이, 됐습니다. So by doing this Valsalva technique, if there is a rupture or perforation of the membrane, you will see immediately bubbles coming out of the osteotomy site, but you didn't see any, right? Because there was no perforation. So we are good for the further bone graft. 자, 픽스처는 4.5에 8 준비해 주시면 되겠습니다. So additional bone graft goes inside. And do the additional bone modeling. 자, 또 좀 딱딱딱 때릴 거예요. Okay, and do the final bone graft here. I'm going to leave a little bit of bone graft because I want to do the additional GBL. As you can see, there is no palatal bone. So this is the main reason that I'm saving a little bit of bone, osteon 3 collagen mixture with the autogenous bone, and I'm going to perform the additional GBR here. And final molleting here. Very good. 자, 그리고 다시 한 번만 너무 세게 하지 마시고 코로 한번 좋습니다. So you see any bubbles and I didn't. So it means that there is no perforation at all. So we are ready for the implant placement. Again, this is the handpiece and the program should be properly positioned to program 2 because there will be no high speed rotation and there is no irrigations. And I'm checking this fixture mount again. And this is the final 4.5 and 8 millimeter implant fixture. Removing. Secure. Tip it over. And then carefully we're going to place it. So I need the Periosteal Elevator for the proper positioning. And finally, this is your last chance to correct the path and depth and everything. So take your time, do not rush, check everything, and then start your placement. So slowly, one by one, and one by one. Yes, there's a very strong resistance, which means a very nice placement. So, because we do not have any palatal soft tissues, so today we are going to do the submerged GBL, and we are going to connect the cover screw, and then we will do the proper GBL again. So, like I said before, 자, 커버 스크류 2개 주시고요. 자, 뼈 이식하고 꼬매고 마무리 하실게요. 고생 많으셨습니다. So how can we create the space for the bone graft? The best way to do this is, as you see, there's a very thick palatal tissues. 거기 좀만 이쪽으로요. So if I trim it using this blade, it gives me extra space. Do you see that I placed just the incision, and this amount of soft tissue will be removed, and I have further spaces for the proper GBL. So this amount of space I just created without any releasing incision. This is a very simple trick. Trim it and thin the palatal tissue. Then you will have much more space. So the releasing incision can be a little bit easier. So now we're going to connect the cover screw first. When you are dealing with a small instrument, sometimes you may be afraid. So this is my recommendation. Put the gauze into the mouth cavity. And in case if you drop it, it's not going to properly protect it, but it's going to help you a little bit better. And this is the way you hold the cover screw. Connect it, hold it with the thumb and index finger, and my middle finger always supports it. It doesn't drop it. So this is the very nice way to deliver small instruments inside the mouth cavity. So this is the way I move it. And today I'm going to 석션을 잠깐 빼주실까요? 네, 고맙습니다. 아니, 좋습니다.
조금만 왼쪽으로 돌려보실까요? 네, 감사합니다.
And using my left hand, I'm using this tissue plier to hold on top of the drill. So this way, I do not drop the drill too. So this is the best way for the safe implantations. Now the first cover screw is connected, and the second screw is again thumb and index and the middle finger. Your right hand goes in, and your left hand with the tissue plier applies pressure on top of the screwdriver, and then you just rotate the driver and the screw will find its way in. So this is how you manipulate the small instruments without dropping it. Now you can remove the gauze. So we have two implants placed, beautifully placed, and we have a huge defect. So we are ready for the bone graft. We're going to place the bone graft first with the osteon 3 collagen mixed with the autogenous bone. 저희 오스테온 3 콜라겐 하나 더 주세요. And using this Periosteal Elevator, I condense it a little bit more to the fixture site. And what I need is just a small osteon 3 collagen for the implant number 17. 네, 맞습니다. So I have the osteon 3 collagen in a plastic cover, and using the tissue plier, I'm putting it into the vial again. This is a very strong, very hard osteon 3 collagen, but if you put your saline, it is immediately hydrated, and it's moldable right away. So you can mold it like this. So you can mold it. So it was very hard, but now you can manipulate and it stays in shape. So it's a very nice way to apply the bone graft. So imagine that you are dealing with the particulated bone graft. So it will move around and they will go away. The assistant can suck up all the bone graft, and as you can see, the bleeding pushes away the bone graft. So it will be very difficult with the granulated bone graft, but with the osteon 3 collagen, it's easy to manipulate. And this is the final situation. The tooth number 16, 17 is covered because we're going to expect a bone remodeling. It will be maybe have some shrinkages or movement or a little bit of resorption. So we expect it, and we do the subcrestal implant placement by augmenting bone graft on top of the implant surface. So this is what we want. So using the collagen membrane, we're going to place the membrane on top of the osteon 3 collagen and do the sutures. 혹시 콜라겐 멤브레인 작은 거 하나만 주실 수 있나요? So while the assistant is ready for the collagen membrane, yes, this collagen membrane, we will prepare for the suture technique. 5-0 하나랑 6-0 하나씩 주시고요. So this is the collagen membrane, also very thick and firm. It's not easy to manipulate in the beginning, but immediately after you hydrate it, within 1 minute, it becomes very flexible. So you will have easy flexibility to manipulate. Removing the plastic cover, and we are using this collagen membrane. Okay, there was a very great question from Dr. Teddy. The healing abutments will better support the space maintenance instead of the collagen cover screw. But the reason I use the collagen membrane is to properly do the GBL, just like the old conventional way. So this is the reason. And also the space maintenance is not a big problem here because it's contained and inside the bony housing. So I don't see a very much difficult space maintenance problem here. So I do a little bit of the folding here, just like folding here, and also do more folding. Okay, so it's like the origami. So you fold it and you apply on top of the implant fixture, and hopefully it will just fit in to the defect. Okay, just like this. Yes, I should a little bit trim because the palatal side is a little bit too long. So I'm going to trim it. So I'm going to trim it to the palatal aspect a little bit more. And then trim it again. Okay, then we are ready. So insert the collagen membrane typically, and then onto the palatal aspect. So the membrane is properly positioned and we are ready for the sutures. So dear watchers from all over the world, we have placed 2 implants with a slight crestal approach with the GBL, and we have done additional GBL procedure mixed with the autogenous bone graft, and we are doing the submerged closure. And we will see that if there is no problem for the tension-free primary closure. So I see a little bit of tension, so I'm going to perform a little bit of the releasing incision on the buccal aspect. So I'm taking out the blade number 12. 자, 석션 잠깐 빼주시면 되겠습니다. 감사합니다. So I'm going deeper and deeper, cut the only slight portion of the periosteum, and also cut the only slight periosteum. I do not go inside the deep periosteum, but these days I scratch, a little bit of scratches on the periosteum, and they give me better flap reflection. So these days the surgery has been changed many, many ways. So I think that we're almost ready. Yes, it looks like. 5-0인가요? 네. So this 5-0 will apply the membrane holding suture. 석션 좀 빼주시겠어요? 네. We start from far deep from the palatal aspect without any membrane engagement. So do not engage the membrane. we only start from the far palatal aspect. And the thing that we're going to do is the horizontal internal matrix suture. And you will see what I do. You have entered from the palatal aspect very far, and now we are coming out on the buccal aspect a little bit also far. And it becomes a little bit of the interrupted suture, but stop there and do the reverse movement. If you do the reverse movement, what you will have is the parallel sutures running over the membrane. So this is what we do again. 석션 안 해줘도 될 거예요. So you grab the needle, you come out, and then again you go at the same level at the palatal aspect without engagement of the soft tissues, the collagen membranes. So as you see, if you pulled it, the collagen membrane is pushed down and the flaps is stretched to the coronal aspect, and all the tensions will be held by this horizontal internal matrix suture. So this is how you apply the tension-free suture at the level of the incision line. So this is a very important suture. I'm taking a lot of time for this very important suture. Stay there, and then carefully I create a knot. 그다음에 6-0 쓰겠습니다. So I'm changing to 6-0 sutures. This 5-0 is going to apply the tension and hold the tension, and the 6-0 suture is a very small and very weak, but it does not block any soft tissue healing, so it is the ideal for the GBL or soft tissue surgeries. So we start from the medial aspect. So because you have all the tensions at the horizontal internal sections, so these sutures does not require much pressure. You just follow the knot and do the minimal pressure. Otherwise, the 6-0 sutures usually is very weak, so if you apply much tension, they will be torn apart. So be very careful. So this 6-0 suture, if you had no chance to use this 6-0 suture, today I recommend you, someday you have to use this 6-0. Otherwise, you will not see the beautiful healing results. But once, if you just change this suture material to 6-0, your surgery healing and the results will be completely different from the previous surgeries. So whenever you have a chance, use these 6-0 sutures, starting from maybe Monday next week. So if you only change the suture, it will give you a whole new world for the operation. So what kind of suture technique do I use along the incision line? No, just the simple interrupted suture that's it. So no much more surgeon's knot, and do the simple suture. But all the technique and all the force and all the important action will be done by 5-0 sutures at the base of the flaps. 이거는 좀 나눠서 갈게요. So these 6-0 sutures usually have a small length of the needle, so that's why I'm doing this separate movement here. 감사합니다. So I think I'm almost done with the sutures, 2 or 3 more sutures. And then we will take the x-rays and we'll be back for the discussion. 자, 한쪽으로 몰아서 자, 컷 해주시고요. I think that one more at the medial aspect here will be required. Yeah. And at the papilla-based releasing incision at the tooth number 14 and 15, you just do the simple interrupted suture and it will heal beautifully without any scar formation. This is the amazing healing potential only you can see at the papilla-based releasing incision. So I'm moving the suture nuts to the palatally. So almost done. 앞쪽에 하나만 수쳐 더 하고 마무리하겠습니다. And I think that this will be our final suture here. Engage the flap. And carefully come out. 석션 한 번만. 네, 가볍게. 네, 좋습니다. So, do you see that a very small, delicate movement? Because this 6-0 suture is so small and fragile, so you cannot really apply much tension like you used to do. So be very careful. Move in a very small, limited spaces. And do you see that it's already nicely matched because this flap has been surface to surface. The healing will be quite nice also. So after the surgery, what I do is use this manual pressure always because there will be some dead spaces and also there will be some hematomas. So before you send the patient for the radiographic examination, always apply some pressure and properly do the bleeding control, and then apply the wet gauze packing, then the patient is ready for the radiographic examination. So I hope that maybe you can see a little bit, yes. 잘 보이시나요? Yeah. So this is the end of the surgery, the mid crestal area. And the distal aspect, I did not do the sutures, but 5 and 6 sutures, that's it. So this is the GBL 2 implant placement with the crestal approaches done in a quite simple way, but we will have to see how the healing will be done. So we'll be back after this short video. 동영상 틀어주시면은 저희 수술 마무리하겠습니다. So thank you for staying with us with this surgery tonight. And this is the result. As you can see, I have placed 2 implants. The simple implantation for tooth number 16 and tooth number 17. It required the GBL and the crestal approach for sinus lift. And they were both 4.5 8mm implants. And I've used the autogenous bone graft with the osteon 3 collagen, and the collagen membrane from Dentium has been introduced. Unfortunately, the path is not really great as I expected, but due to the uneven bony structure, it was maybe some miscalculation. So this tooth number 17 is in the right position, but the angulation is a little bit 10 or 20 degrees shifted. So we will have to later correct this by doing the wonderful prosthetic procedures. So there were great 2 questions, but of course there were a lot of great questions, but due to the time limit, we have chosen only 2 questions. Number 1 question, Dr. Ahmed Abu Senaina, you asked us why we have go for the crestal approach and did 10 millimeter drilling but placed the only 8 millimeter? That's a very great question. In the very modern dentistry, 10 millimeter dentistry, 10 millimeter implant is a standard 10 years ago. I placed 12 and 13, 14 long implants. It was the 10 years ago, but now the standard has shifted because we have a better surface, better primary stability, and better implant prosthetic procedures. So 8 millimeter is becoming a standard. And when we place the implants, now the patients live a quite very long life. So we have to expect at some point we may have to remove the implants. So if I place the longer implants, when we remove it, it will be a very aggressive surgery to remove the long implants. So that's why I have chosen only 8 millimeter. And also at the palatal aspect, there was only 2 or 3 millimeter remaining bone. So I did not want to go too much long implant exposed. So I want to make a short implant a little bit rather than the 10 millimeter. I placed the 8 millimeter. So that is the one reason. And as you can see, 3 or 4 millimeter bone is grafted on top of the implant at this moment. But later you will see that after the healing period, these bone graft particles will come down. And they will be matured, but they will be thinner. So if you place 10 millimeter and you do the crestal approach, but after a couple of years later, this bone volume will go down. So I do not like or favor going too deep into the sinus cavity, but I want to go as shallow as possible, but as deep as required, just like the old saying says so. And the second question was, Dr. N. Seng from Singapore, you said that when I do the bone graft for the sinus lift, how do I check for the Schneiderin membrane integrity? Usually, large part, you have to take the cone beam city. By taking this cone beam city, you get the general idea. Today, I have seen the CBCT and there was a thickening of the membrane. So which means that the more chance maybe I will have if I do the aggressive crestal approaches, but due to this thickness and a little bit of the hardening of the membrane, it was easy for me because when I touched the membrane, it was quite intact and it did not break, as you can see from the x-ray. So the bone is grafted nicely in a dome shaped. So all of the information about the Schneiderin membrane integrity comes from the cone beam city. And secondly, as you have seen during my surgery, I do twice the Valsalva technique by holding the nose of the patient, and I ask the patient to breathe through the nose. And then if I see the bubbles through the membranes, and if I see the bubbles through the membranes, and then I get the idea. If the membrane has been broken, the air and the bubble will come out. And if there's no bubble, only water or blood comes out, and the membrane is intact. That's how you get the idea. So before, cone beam city, and during the surgery, Valsalva method. Now, you are seeing this panoramic view. As you can see, this is the very old implant. 13 years ago, 2 Dentium implants has been placed, and it's quite nicely maintained. This is the beauty of the Dentium implants. Long-term longevity is expected, and you can see a nice marginal bone reaction. It's quite nicely stabilized. On the other side, these are 2 implants that I placed today. I tried to place 2 parallel implants, but actually I get the misinformation from the uneven bone. Then the tooth number 17 is slightly medially and distally angulated around 10 or 20 degrees. But later we can fix that at the prosthetic procedure. So at this point, the most important thing is the primary stability for the prosthetic process. And today we have achieved a great primary stability, and also the GBL. As you can see, there was no bone at all at the palatal aspect, but by the mixture of the autogenous bone, which has a great healing potential, and the osteon 3 collagen, which is the bone, but mixed with the collagen, 5 to 8%, and they are mixed together, and they are stay in shape. So this is the most important thing, stability of the bone graft. On top of that, I have applied the collagen membrane to better support the stability of the bone graft. So maybe 3 or 4 months later, we will do the exposure, second stage surgeries. At this level, we are going to thin down a little bit soft tissue because today, as you see, there are too thick soft tissue. So we will remove a little bit of the soft tissue and then deliver the healing abutments and wait another 1 month, then we will do the proper prosthetic procedure. At that time, we are going to decide whether we will keep tooth number 46 and 47 because at this moment, it looks like stable, but when there's a functional loading, maybe the patient will feel some pain or discomfort. So we have time and we will slowly do the perio treatment and we will evaluate whether we will do the extraction or not. So thank you for staying with us. It was a great experience for me here to perform the surgery in front of you. And I'm very happy to be connected by this chatting and the questioning and answering sessions. And if you have further questions through the website or YouTube comments, please leave a very good questions and we will stay connected. Thank you very much for staying with us tonight.